Hey, I'm coming in for my next installment of the Vagina Dialogues, and today I want to talk a little bit about birth prep, in particular, perineal massage. Now, I know that this is just a crazy time in the world, and none of us imagined this was what the next 4, 6, 8 weeks of our life were going to look like. And I feel for all of us in this situation. I know that we're all doing the best that we can. But one group of people my heart is particularly going out to is people that are preggers right now. There is a time limit on what is going to be happening with that. And I know as there's a lot of discussion about reduced birth support, that I'm feeling that even more. So research does tell us that after 34 weeks of pregnancy, perineal massage has been shown to reduce tearing, reduce need for number of stitches, as well as reduce severe tearing to the perineum. So this is something you can do at home without basically much tools. So there's a lot of different ways that people do this, but the goals in my mind for doing perineal massage are a couple of things. Number one, it has been shown to improve blood flow and tissue elasticity, and tissue that is more elastic or more flexible can stretch as opposed to tearing or ripping, okay? Number two, I really find it's very helpful to prepare for birth, meaning understanding where that tissue is and what it is like to lengthen against a stretch. When that baby comes down through there, there's going to be a stretch on that tissue. And this allows you to practice that or get in contact that or prepare for that. Okay, so what I'm gonna do is I'm gonna sacrifice my body for you people. So, what I won't do to help you prepare. Okay, so we're gonna pretend that that's a 3 and this is a 9, okay? So my mouth is gonna be the vagina. I know, shocking, one orifice to another. So up towards my forehead is going to be up towards your pubic bone, and then down towards my chin is going to be down towards your tailbone. So what you can do is you're gonna take nice clean hands with nice short fingernails, and you are gonna insert most often your thumb about an inch in. So you're gonna take that digit and you can use both some kind of a gentle water-based lubricant, like Good Clean Love or Slickwood or slippery stuff. You could use nothing if you're comfortable with that, or you can even use some natural oils like almond or olive oil. So you're gonna get yourself prepped, your hands, and have everything that you want there. And you're gonna either be in a reclined position with your head supported and your knees supported, or some people even feel comfortable doing this standing up with a leg, say on the toilet or on the edge of the shower. That can be another way to get in contact with this area, okay? So again, lots of different ways that you can do this, but what I like for my patients to do is take that digit, and we're gonna be working at this 3 to 9 o'clock area. We're not gonna be going up here towards the pubic bone or up towards the nose, okay? You are gonna get in contact with that tissue, and you are going to pull out at a pretty moderate level, meaning you should feel some stretch. You may even feel a slight burning around that opening. Nothing severe, nothing sharp and painful, but you're gonna feel some stretch. And what your body's gonna wanna do when you do that is it's gonna wanna pull back, right? It's gonna wanna pull against that stretch. So part of what this awareness is you being able to lengthen and breathe and let go into that sensation. So you're gonna hold that and hold that stretch from anywhere to 60 to 120 seconds or 1 to 2 minutes. You're gonna hold there, you're gonna turn and hold, and you're gonna go all the way around your 3 to 9 o'clock. Now, the vaginal opening is much smaller than my mouth. It's more about this size, okay, once it's being stretched. So, you may only get to 1 or 2 or 3 or 4 spots along this side, okay? So I have people hold that and move and hold in those different locations. Now, particularly the 6 o'clock position down by your tailbone, if you do that and you feel like you need to pass gas, you're putting some pressure on your rectum. So move off of that and continue to stretch the rest of that tissue. You are not gonna be inserting that thumb as far as you can. Again, it's gonna be going to about that first digit or about 1 inch. So you're gonna be able to kind of grasp onto that tissue and pull without slipping, but your finger is not gonna be all the way inserted inside, okay? So once you've held those positions, you can also do some sweeping. You can pull out against that tissue and move it. And that has been shown again to help with some of that elasticity in that blood flow. So we're getting all of those good elements, right? We're getting that good sense of where these tissues are, how to lengthen and relax into it, as well as moving that around. So all of those, depending on how long you hold each of those spots for, this whole thing should take you about 6 to 10 minutes. And the research was shown on people doing this most days to every day. So this is not one of those things you're gonna do it 34 weeks and then just stop. It is recommended that you continue to do it from that point on towards birth. So share this with your friends, get prepared for birth, and just know that so many of us out here are really thinking about you in this time of the Corona apocalypse and preparing for you to have your baby.